Hello, everyone, and happy Friday, everyone. This is Amita from NourishDoc, a platform for natural and holistic therapies. In our session today, we are going to talk about regenerative medicine. What exactly is regenerative medicine? I have no idea, and that's why we have a guest. We have Dr. Ashok Bhandari, who's going to join me in few seconds, who's going to talk about regenerative medicine, Ayurveda, as well as naturopathic medicine. And he's also going to talk about how does exactly it works, the regenerative medicine. And what exactly, he's also going to talk about stem cell therapy, which is like the cutting edge technology right now in integrative medicine, within integrative medicine. So all these topics we are going to be discovering, we're going to be talking about with Dr. Ashok Bhandari, who, like I said, has been an Ayurvedic, regenerative, and naturopathic medicine doctor. So I'm waiting for Dr. Ashok to join me, and in the meantime, if there are any questions, any comments, any feedback, hold on to those questions and comments, and then you can ask Dr. Ashok. Hopefully he joins me in a few seconds. And then just to give you a brief background on Dr. Ashok, he has been a national level athlete, and when he was younger, and when he was in college, and over the years, he became an expert in regenerative medicine. So Dr. Ashok should be joining me in 1 second, and we all right. So anything else? Well, there you are, Dr. Ashok. How are you?
Good. How are you doing?
Happy Friday.
Happy Friday to you as well.
Yeah, although we have sessions going on the weekends all the time, but still it's Happy Friday for us.
Absolutely. I mean, Fridays are usually my day to get out of the clinic and do things like this. So it's always a nice day for me.
Great. I was telling our viewers that we are going to be talking about regenerative medicine.
Yes.
But before we go into that, Dr. Ashok Bhandari, maybe even is joining us right now. He used to be an athlete, a national level athlete. And then from there, he's become an expert on regenerative medicine, Ayurveda, naturopathy. So tell us a little bit about yourself before we go into the topic.
Sure. So yeah, when I was young, I was an athlete growing up. I tried track and field and then martial arts. So I did kung fu in Canada, and for a while I was competitive. Yes, I was competing in the national competitions in Canada, and I had a lot of injuries myself. I hurt my neck, hurt my back, hurt my legs quite a bit. That sort of transitioned me into what I ended up studying, which was exercise physiology. And from that, I ended up moving into working with elite athletes. So I was working with NHL level hockey players, professional amateur level hockey players, and some other athletes, football and soccer. And I really enjoyed that. But from that, I transitioned to working with cardiac rehab, and then started doing some rehabilitative exercise, and my passion for sports and sports medicine was evolving into a little bit more health and medicine. So that's what led me to, along with my own health journey, led me to naturopathic medicine, and that's when I did my doctorate as well as my master's in Ayurveda, and I actually complete my master's in Ayurvedic medicine in India. So that was really nice to be able to do my the final little part, my externship. At the Rajiv Gandhi hospital up near Dharamshala, near Paprola. Yeah. So, that roundabout through medicine, I still gravitated towards sports medicine, and I started doing more and more work with pain and regenerative medicine, and we are.
That's great. That's great. Someone's asking, what is the topic? You just joined us, so you missed it. Well, the topic is regenerative medicine, and we have an expert in Ayurveda, naturopathy, and regenerative medicine. So tell us what exactly is regenerative medicine.
Sure. So it's definitely a growing field. It's like the new kid on the block, but in some ways it's been around for a while. Regenerative medicine is this growing field in the integrative medicine world, right? It focuses on helping the body heal itself. Now, if we look at just that definition, I mean, medicine has been doing that for a long time. Ayurveda has been doing that for a long time. medicine, homeopathic medicine, all the world medicines have done this same type of thing. But really, that field of regenerative medicine, how we speak about it now, is the combination of our traditional world medicines and our foundational principles along with cutting edge technology. Mm-hmm. So a lot of people like to, when they hear regenerative medicine, they think immediately to regenerative injection, like prolotherapy, platelet-rich plasma, stem cell therapy, which really is regenerative medicine. You are you are helping the body heal itself. But the way I look at regenerative, it is way more than that. It's everything about optimizing the whole body, allowing them to heal better, become more resilient, age slower, and just generally feel better overall. And so that's how I would describe regenerative medicine.
So yeah, no, I think, and you mentioned about the stem cell therapy and the PRP, platelet-rich plasma. Are these the tools for the regenerative medicine? I mean, so I'm trying to understand for our viewers, like Ayurveda, I think we understand it. When we talked about, they have a system, like a framework in place, dinacharya, dinacharya, ritucharya, and then they have all these constitution, all that, it's a very nicely beautiful framework. How does the framework work for regenerative medicine is what I would like to understand.
So that's a great question. I think that's a perfect way to describe this. So the basis, whether it's naturopathic, whatever, that, you're working on your dinacharya, working on your dosha, your constitution, that's super important, because regenerative medicine is about, like I said, healing the body, helping you age slower and last as long as possible. So diet, clean water, good sleep, physical activity, exercise, clean air, social engagement, mental, emotional health, all of these set the groundwork. They allow the body to heal the best. And now all we're doing with something like prolotherapy, which is a dextro sugar water based injection therapy, or platelet rich plasma, which is a therapy where we take the blood from a patient and we concentrate it down through a couple of processes and take out the red blood cells and discard those. And we use the plasma and the platelet growth factors that are in the blood naturally. And we can inject that back into areas of injury. So specifically, we talk about musculoskeletal injuries. For example, say somebody has a rotator cuff tear or somebody has arthritis. We can put the platelet-rich plasma there. Now, in reality, the platelet-rich plasma itself isn't doing the healing. It's the body that we're putting in is doing the healing. The platelet is just a signal to say, okay, come here and heal this. So if you have a very, very healthy body, robust body that's, in balance doshically, you follow your dinacharya, ritucharya, you're eating the way you should be, you're exercising, sleeping, have all your nutrition, you're going to heal really well.
Yeah.
But if you put platelet-rich plasma, if you take the blood from someone who doesn't do any of that, doesn't have the foundation, and we inject it back in, it's not going to work very well. So that's that piece of regenerative medicine. The tools, like you said really well, PRP or stem cells, that's just the signal to tell the body to start doing the regenerative process.
Got it. But the foundation is still the diet and the exercise and the mindset, like all the other integrative natural therapies talk about, right?
Absolutely. So, when I do regenerative medicine in practice, I have patients come to me, because that is most of my practice now is regenerative medicine and pain. So patients will come to me and say, oh, I have knee pain or I have hip pain. I think I need PRP. I think I need stem cells. And we'll say, okay, well, let's start with this. Let's look at your diet, your nutrition, your exercise, physical therapy. We look at their hormones, look at their sleep. We look at their environment, and we look at their daily routine. We get all of that organized, and, we look at it 5-6 weeks later, and all of a sudden they're like, yeah, so do I still need the PRP? And I'm like, no, you don't need the PRP. You healed. You didn't need that signal that was stronger. Some people do. Some people have a more drastic injury. Some people have more degenerative condition like severe arthritis or something like that. But oftentimes when there's mild issues, you don't end up needing the regenerative piece. It's just about optimizing what the body already has, that diet, exercise.
So okay, so tell us, like like in functional medicine, like they do a lot of testing. You know, there's a lot of testing that they do. So is that the same principle that you that is applied in regenerative medicine also as well? Like people come to you, like you just explained, that somebody has a knee pain. Are you going to do the testing, or is it more like a questionnaire that you would kind of try to understand that person's constitutions per se?
Good question. So one of the biggest things is it really depends on the the best answer in medicine, right? It depends. It
Yeah,
depends exactly what the patient's coming in with,
yeah.
but I tend to focus more on the patient's experience. So, patients will come in and say, I have this MRI, I have this test, I have this. And
Mhm.
usually I put all of that aside. And the first question is, what's your experience with this? Tell me the history of that. And now, Ayurveda helps us guide that process as well, because understanding history, understanding the process helps us
Mhm.
the foundations of the person. But, really when it comes to pain, for example, the most important piece is a physical exam. So
Mhm.
looking at the joint, the functional movement, how well are they using it? How well are they moving? That tells us more, way more than any exterior MRI can tell, for the
Mhm.
most usually, So people can come in and say, oh, I herniation discs L3, L4, L5. And, I'll say, so what? What's your pain? What's your physical exam tell me?
Yeah.
Because most of the time, and I'll tell you this, and the research nowadays is more and more supporting this, that surgery is no better
Yeah.
disc herniations. So exercise in that case can be regenerative, right?
That's right.
You
Yeah.
can heal the body by optimizing how the body moves and
Mhm.
supporting the structures, right? So it's more about finding what the experience and the functional process is for the person. So in some cases, yes, when we're dealing with hormone dysregulation, when we're dealing with environmental toxins, absolutely testing can be very important, whether that's blood testing, whether that's urine testing, or heavy metal testing. There's rare occurrences that I will do that. Um,
Mhm.
but that does come into play. Um, but really where I focus is finding the experience of the person and optimizing their foundational health.
Got it. Got it. So tell us a little bit about the stem cell therapy as well. When is that needed, and what kind of medical ailments that it can help with?
Absolutely. So stem cells, now this is an interesting field, especially, I practice in Seattle, Washington, in the United States.
Yeah.
So it's an interesting field because every country kind of have its own laws and regulations around stem cell therapy. In this country, stem cell therapy is specifically referring to essentially two types of therapy. One is stem cells coming from fat,
Hmm.
and the other is stem cells coming from bone marrow. Outside of those, in clinical practice,
Hmm.
nothing is technically considered stem cells.
Hmm.
In other countries, you can get stem cells that you can grow out and you can culture, but I'll speak to, in this country. So stem cells is a type of regenerative injection therapy. And in that case, we're actually using the body's own real stem cells. And we're
Wow.
those and we're isolating those and putting them back in. And really, we're doing a process which is considered minimally processed in the
Hmm.
sense that we take a fat transfer. So we're doing adipose-derived stem cells, which is the most dense area of stem cells in the body. Where we take the stem cells from there, we're putting them back in areas where similar tissue would exist, fat pads, um, injuries to associated like that,
Hmm.
and you can inject those back in. What happens with that in a very simplified form, the stem cells themselves most likely are not turning into new tissue and healing new tissue and growing new tissue. What they're doing is they're a much stronger signal, and they're changing the environment of the area that we're injecting them. So they go in and they start releasing signals in these
Yeah.
these little compounds, these little molecules out. And they're signal messengers. They tell all the cells around the area, say we put a knee. They say, okay, we need to turn off the degenerative process and turn on the healing process. So
Got
again,
it.
it starts recruiting your body's natural healing capacity. It recruits your body's natural stem cells to come and heal that area. It's
Hmm.
more signal to change the environment, to provide a healing environment instead of a degenerative, injured environment.
Mm-hmm.
Very, very powerful therapy to reverse disease and start healing injury. So right now they're being studied in a lot of different areas. Musculoskeletal pain is one and regeneration is one. But neurological diseases like multiple sclerosis, Parkinson's, certain types of cancer, they're doing stem cells, IV stem cells.
Mm-hmm.
Type 1 diabetes, they're looking at
Mm-hmm.
for regrowing beta cell function. Different areas that they're being studied for right now. My practice primarily involves adipose, so fat-derived stem cells, for immediate reinjection for musculoskeletal injuries. And usually this is reserved for the most severe cases. This is when we have much more damaged joint or injury area where like PRP won't be enough of a stimulant to the tissue. So, we're talking more grade 4 osteoarthritis. We're talking, we've damaged the cartilage all the way down to the bone. We have bone injury. Injuries like that, we will start to consider themselves.
So it would be an alternative to surgery, right? The PRP and the stem cell, you don't have to go through a surgery at least give these two things a shot, right?
Absolutely. And how I usually describe that to my patients is surgery is always really there. It's almost always, that's still going to be an option, but you can't go back from surgery most of the time. You can't, bring back something you've cut. So surgery is usually, I think, last resort. And my whole goal is to treat pain without surgery or drugs. That's my two things to work on. And so, yes, PRP can prevent the need for surgery or delay surgery. For example, knee replacements, if you can delay 10, 15 years for a knee replacement, that's a lot more years of function before you have to get a surgery, and you can stay healthy and you can stay active before having to go under the stem cells, same thing. Sometimes, and the most cutting edge in this field, this is really going to be the future, I think. It's starting to do this already, but it's really going to grow a lot, is combination of them. So if you have a joint that's very damaged and the cartilage is very damaged, a surgeon that's well versed in regenerative medicine and orthopedic surgery can go, they can open up the joint and they can take stem cells or PRP and they can put it right into the area. So they can put the stem cells right in there, heal the ligament or heal the cartilage damage with stem cells, then close the joint up. So we can use a combination of these things. There's been some very preliminary research in this field, and it looks amazing, but we just need more research to understand what's a good idea, what's the best way to optimize that. And the other piece is going to be adoption of this into the broader field. This is still a very, very new field. And so there's more and more new kind of things coming out with the regenerative medicine process. I talked about PRP stem cells right now, but there's a whole other field of things like what we call peptide therapies. Peptide therapy is a little lesser known, but these are basically small, short amino acid structures. So small proteins, small peptides that naturally occurring in the body, some are synthetic, that we can use to help, again, signal the body to do things. So little peptides that we can extract and isolate from the human gastric mucosa or juice and basically tell the body to start healing things as well. It's fascinating. There's peptides that can help reverse what we call senescence, or basically the end of the cell cycle for regeneration. Cells age and they come to the point where they get to an age and they start basically not regenerating anymore. They're not going to they're not going to regrow. They just die off. This is the aging process. We have peptide therapies that are showing that they can stop that process. They can get rid of cells that are what we call senescent, or basically dead off, and they can keep that process from happening too much. Down the aging process, reversing this aging process. So, the field is wide and vast, but again, I really like to emphasize it's only as good as the body we're using it in.
Yeah. Well, all of us will live for like a couple of 100 years or beat beat Queen, you know.
Right?
You know what I mean? Like, but this is amazing stuff. I mean, to all the viewers, we're watching we're talking about regenerative medicine, and PRP and stem cell and peptide therapy as an alternative to surgery. And it's fascinating what Dr. Ashok is explaining us. It's brand new, all these concepts for a lot of people, I'm sure, but we need to learn about what's going on, right? So that we can at least use as much natural therapies as possible to help ourselves live a better and healthier life, for that matter.
Absolutely. I completely, the biggest thing is the education on this field,
Yeah.
making sure people are aware of these.
Hmm.
It's still a growing field. It's still a small, circle on the map
Yeah.
of, treating injury, pain, and general health, right?
Yeah.
I had a patient who was going through a multiple sclerosis
Hmm.
stem cell therapy trial. So,
Wow.
there are trials that are happening where they're doing IV stem cells to
Hmm.
potentially help regenerate those injuries, the degenerative process for multiple sclerosis. I've had dozens on dozens on dozens of patients that I've done ERP and several stem cell treatments on, and the vast majority come back saying, this is incredible. You know,
Hmm.
we were able to put off surgery. We were able to get them back to doing things that they
Yeah.
never thought they were going to do again. Patients that would come in and say, I had surgery on my hip and it didn't help the pain and I can barely walk now.
Yeah.
Now I just had a patient a couple of weeks ago message me and said, I'm still dancing, I'm still running. And 2 years ago, I couldn't do any of that. I could barely walk. And she,
Yeah.
I'm trying to convince my mom to do the same thing now, and so it's incredible to hear those stories. And
Yeah.
it really starts with letting people know that there is an option. Surgery sometimes is very, very necessary. You know, our modern advanced medicine is absolutely incredible and it's life
Yeah.
saving. Very, very fascinating, amazing field that can help us when we need it. You know, but if we can delay that process of needing something like a knee replacement or surgery to recorrect a injury or ligament injury, and we can help heal that without having to open the joint, I mean, that's best case scenario.
No, I think it's beautiful. I wish I was also not aware of that. My mom went through her knee surgery, a couple of years back, and like to your point, it's not that she's running or walking. I mean, there's still a struggle. The surgery didn't help. I mean, not that I'm trying to undermine the surgery, but what I'm trying to say is that, if there were any other alternatives that we knew about it at that age, that would have been probably better from a healing point of view, you know?
Absolutely. And I think, and I kind of touched on, but I think that's one of the things that people don't expect from this process. That sometimes we need, for example, say knee replacement
Yeah.
because of arthritis, but you know, knee replacements only work as well as how well the surgery goes and how well the rehab goes, how well you use your knee afterwards.
Mhm.
And if you are not, if the body isn't healthy enough, fit enough because of injuries, because of to be able to do the exercise and rehab either before or after surgery, then the surgery.
Well, we're having some network issues, but to all the viewers who have been watching this session, I think it's a fascinating session on regenerative medicine. How regenerative medicine can help with different type of medical ailments, like Dr. Shok, the way he was explaining on PRP, on stem cell therapy, on peptide therapy. Let's just learn together about all these other possibilities and alternatives. So with that, I think Dr. Ashok had, problems with his network. I'd like to wrap up this session. Hope you enjoyed this session. And if you did, if you have any questions, let us know and help us spread the word, help us share these sessions so more people are aware of alternatives. Like in today's session, we talked about regenerative medicine and stem cell. More people are aware of how it could help them. With that, signing off, this is Amita from NourishDoc. Have a great weekend, everyone. Bye-bye now.